For me, the key issue was the potential vulnerability of the primary healthcare nurse practitioner role in Canada. Because primary healthcare is so dynamic and undergoing so many rapid changes that we've moved relatively quickly into an area where we very soon may face, if anything, a physician surplus, given the number of medical student positions that have been added to the system. Also, because of interprofessional collaboration and the new ways that primary healthcare has been delivered, family medicine has become a much more attractive option than it was for some time. And so many more residents are going into family medicine than we have had. And then last, we now have the introduction of physician assistants. And so that's another group that's on the scene. And so there is the possibility that the primary healthcare nurse practitioner role can become vulnerable in this situation. So I would say there are 3 actions that need to happen. The first is that we need to demonstrate the value added of nurse practitioners and their economic efficiency, and we need to be able to present that to the governments of each of the provincial and territorial jurisdictions who fund the primary healthcare nurse practitioners, because they in fact have a pot of money to deliver primary health care. They need to make decisions on who they will fund in order to deliver that. And so it's incumbent upon us to help them understand the evidence around the effectiveness and cost effectiveness of that role. The second thing is that even though there are lots more players coming on the scene, the important thing is to look at who are the high risk, high needs patients who we believe that primary healthcare nurse practitioners can play the best role with. So people like our long-term care settings, the residents who live in long-term care, people with mental health issues, the whole emphasis on health promotion and disease prevention that primary healthcare nurse practitioners have been taught to do, and chronic disease management. And the third thing is to set up jurisdictional, and by jurisdictional I mean provincial and territorial, associations of primary health care providers. And these associations would look at all of the issues that are facing primary health care as they change rapidly. And so as more physicians are trained, as the physician assistants do enter the system, how will we work together? How shall we change the way we work in order to meet all the patient needs? What are some of the funding issues we need to address? What are some of the incentive issues that we need to address? And how do we best meet patient needs? And because this is so dynamic, it's time to have everyone, and by everyone I certainly mean representation of all the primary healthcare providers, but also the government, at the table to say, how can we deliver the highest quality primary health care for the least cost?